Hi, I am Dr. Niveditha Bharathy, Consultant Obstetrician and Gynecologist at 𝗏𝗺𝗆 Specialty Hospitals, Vanagaram, Chennai. So today I am going to talk about menopause and its effect and what are all the treatment options available for menopausal symptoms. When we talk about menopause, it is important for us to know what is menopause. Menopause means, meno means periods or menses, pause means, as you know, stop. So when the periods stop for a woman, we call it as menopause in simple terms. That means the cessation of menses because of cessation of function of the ovaries in a woman. So when do we call, what is the average age of menopause? Globally, the average age of menopause is between 50 and 52 years. But it can happen any time between 45 years and 55 years of age. But when it comes to the Indian women, it happens much earlier. So the average age of menopause amongst Indian women is 46 to 48 years of age. That means our Indian women go into menopause much earlier than when compared to our Caucasian women. So why is it important to know about menopause? Because as we all know, the average lifespan of women and men all over the world has increased. But the age of menopause is still the same, that is at 50 to 52 years of age. For example, if an average woman is living for 80 years of age, she is going to spend 25 to 30 years of age in the menopausal range. So, average woman is going to spend 1/3 of her lifetime in the menopausal time. So that is why it is very important for every one of us to know about menopause, the symptoms and the treatment options that are available so that the quality of life is maintained or improved in women with these symptoms. Then we talk about what are all the symptoms of menopause. The symptoms of menopause can be divided into acute symptoms, intermediate symptoms and long-term symptoms. What are acute symptoms? Acute symptoms are symptoms that happens immediately. So that is when the patients do come to us to ask for relief. So the major acute symptoms of menopause are hot flushes and night sweats. So when we talk about hot flushes, what are hot flushes? Suddenly a woman will feel that she is like a fire that is passing through her body. So that is how they do explain the symptoms. I'm feeling terribly hot. And many times women do tell us, when everybody is sitting in the AC room comfortably, I am just pouring out sweat. So that is what feeling hot and pouring out sweat. That is what is described as hot flashes. And that can be very disturbing for a woman, especially when she is working also. And above all that, the next symptom is the night sweats. The night sweats means suddenly they will be pouring in sweats, and that happens especially during the night. When it happens especially during the night, it is very distressing, and not only that, it will affect the sleep. When the night sleep is affected, automatically it will reflect upon the negative effect on the day-to-day life the next morning. So that is how it affects the quality of life of women with hot flushes and night sweats. So having said that, most of the women do have these symptoms at the beginning of the menopause. When are these night sweats and hot flashes are common? It is very common in the first 2 to 5 years after menopause. So what are the treatment options available? So the treatment options, when we talk about, the first thing is, it is the proper understanding. It is a natural process that happens, but some women can cope up with it better, but some women can find it difficult to cope up, so that their quality of life is affected, their work time is affected, and then we have to give them relief. So as I told you, the first thing is to make them understand it is not only you. Everybody goes through this. So there are ways to overcome this. The first thing is, we have to avoid taking excessive coffee. We have to hydrate ourselves very well. And in the summer season, it will be even more severe by way of symptoms. So we have to use the weather-friendly clothes. Like for our country, which is 24/7 and 365 days, it is hot, we have to wear friendly clothes like cotton clothes and not wearing tight clothes all the time, all these things will go a long way in helping out the symptoms. The next important thing is we have to maintain the hydration, and above all, when the sleep is deprived, we have to follow all the suggestions that I have told you to overcome this, especially avoiding excessive coffee, alcohol, cutting down on the, stopping smoking and hydrating well, and good exercises, and adopting yoga or some meditation to calm yourself. All these things go a long way in overcoming these symptoms. Even in spite of these things, the symptoms, if they are still persisting, what should we do? So we have some medical options available. Of the medical options, there are two types. One is the hormone replacement. The next is the non-hormonal medications that are available. Of the two, the hormonal replacement is the best treatment for hot flashes and night sweats. But provided the woman doesn't have any contraindications, meaning like suppose if the woman has a personal history of breast cancer or a family history of breast cancer, then we cannot give them hormones. Provided there are no hormonal contraindications, hormonal treatment is the best treatment for hot flashes and night sweats. If suppose the woman has got risk factors so that we cannot give her hormones, are there options available? Yes, there are options available, but that has to be prescribed by the physician, again taking into account her risk factors. There are medications that we call as SSRIs, SNRIs, and other medications that are available nowadays, so that we can give relief to the women with hot flashes and night sweats. Next comes the intermediate symptoms. That is always called as the genitourinary symptoms of menopause. So what happens because of the menopause, when the estrogen levels are declining, what happens? The vaginal epithelium becomes thinner, and so they have symptoms of vaginal dryness and dyspareunia. Dyspareunia means they have pain during sexual intercourse. So that also can be overcome with medications. When we talk about medications, it can be again hormonal and non-hormonal. Hormonal is again the local estrogen cream. As I told you earlier, any hormones, whenever we are giving any woman, we have to rule out any risk factors, whether there are any contraindications to the hormone therapy. For example, again, a woman with breast cancer, usually we don't prescribe any hormones. Coming to the non-hormonal, that comes as the first option. That is, vaginal moisturizers are very simple and easy to use, and it doesn't contain any hormone, so we need not worry about any side effects. That comes as a first line of treatment. Failing which, we can give her local hormonal treatment. That is, estrogen creams can be given. That will definitely help her improve the symptoms of dyspareunia. Apart from that, postmenopausal women are more prone for urinary infections also. That is, recurrent urinary infections and urinary symptoms like urgency. So urgency means, suppose if you want to pass urine and if you are not able to reach the toilet, you will leak urine. That is urgency. And recurrent urinary infection is again one of the main symptoms of menopause. To overcome that, again, the local estrogen cream will go a long way in helping to overcome the symptoms of urinary symptoms. And then apart from that, we have to rule out the other causes of the urinary symptoms as well. Suppose if that woman is a diabetic, we have to make sure her diabetic control is good, because diabetes is one reason when women are more prone for infections, particularly urinary tract infections. These two are the intermediate symptoms, that is the vaginal dryness and the urinary symptoms. So next comes the long-term complications. The long-term complications, when we talk about the cardiovascular health hazards and the osteoporosis. Osteoporosis is, as you know, it is the weakening of the bones, and the cardiovascular risk factors, because as we all understand, estrogen is the female hormone that helps women, or rather protects women against heart diseases when she is having the estrogen, that is before the menopause, because all premenopausal women are protected against the heart diseases because of the female hormone estrogen. But after menopause, when the estrogen declines, the risk of cardiac problems in postmenopausal women is more than men. So that is when we have to take care of them. It's not only hormones again, we have to make sure the other factors like hypertension, diabetes and dyslipidemia, that is high cholesterol, all these are risk factors for cardiovascular disease. So when we try to prevent the long-term implications of menopause, we have to take off other factors that are contributing to the cerebrovascular problems, that is cerebrovascular, cardiovascular problems as well. That is most importantly like stroke and heart attacks. So first, and in the management of menopause, it is not only hormones, we have to take care of other risk factors like hypertension, diabetes and maintaining the BMI, that is the height to weight ratio, and keeping the cholesterol under control and keeping our vitamin D levels under normal range and taking adequate calcium and regular exercises, maintaining the hydration and most important maintaining adequate calcium and vitamin D. Of course, practicing methods like yoga, meditation will go a long way in tackling the menopausal symptoms, be it acute or intermediate or long term. Apart from the changes that I have told you about menopause, the menopause also causes changes in the skin, hair. So the skin becomes very dry, wrinkled. All these things are part of menopause and part of aging, and most of the time we have to accept that as part of aging. And of course, as I told you, along with the skin, the hair also becomes, the texture of the hair becomes very thin and sparse, and for all these reasons, hormones is not the first line of treatment. Of course, because all these changes happens little later during menopause, not immediately during menopause. At that stage, women are at a higher risk of getting side effects because of hormone replacement therapy. So most of these changes are better accepted as part of aging, or rather I would say part of graceful aging. And to conclude, I can say review at menopause should also include screening for other risk factors for long-term complications like checking the blood pressure, making the sugars under control, keeping your cholesterol under control, and it is also an appropriate time for screening of cancers in that age for women like breast cancer screening and screening for osteoporosis and cervical cancer screening. Of course, it has to start from an early age and continue till the age of 65 years. So with all this, the proper understanding of menopause, not accepting that as simply as part of aging, understanding the symptoms and the treatment options available will make the quality of life of most of the women very good. Thank you.